Welcome to the School of Public Health here in the Western Gateway building. School of Public Health is part of the College of Medicine and Health. I'm delighted you're joining us here today to hear about the BSc in Public Health Sciences. We'll outline how the importance of public health, what it means to be a student on the BSc in Public Health Sciences, and where you as a student or a graduate of public health can find employment and opportunities after graduation. Come on in and we'll have a look around.
Hello, my name is Ivan Curry and I am Dean of the School of Public Health at UCC. I am delighted to have this opportunity to tell you about the school and about our BSc in Public Health Sciences. The School of Public Health at UCC is one of the largest academic centres for public health in Ireland. The BSc is our flagship undergraduate programme. Public health is a broad and exciting discipline concerned with the health and well-being of the entire population. In public health, we are concerned with saving lives, literally thousands or indeed millions at a time. There's something for everyone in public health. If you have a strong interest in maths or statistics or the sciences, there are huge career opportunities in epidemiology and public health sciences. If your strengths are in languages, writing and communication, we urgently need graduates with the skills and the ability to move hearts and minds as we tackle the major public health issues of our time. Issues such as climate change, social injustice and violence prevention.
Even before a child is born, a quest to ensure its long and healthy life begins. All over the world, public health programs work to improve the health and well-being of communities by identifying the risks that affect different people, in different places, at different stages of life, and finding the best ways to minimize them. It's about giving everyone the best chance to lead long, healthy, fulfilling lives from the very beginning to the very end. A child dies every 3 seconds from infectious disease. But public health interventions can prevent this by promoting things like breastfeeding, immunization, and antibiotics. Where children die because they have no access to safe water or basic sanitation, public health programs can make water safe and conditions sanitary. Where research shows us who has the highest risk of developing certain conditions, public health applies it to the real world. It turns evidence into the advice and practical help we need to lead active, healthy lives away from danger. It helps us make the right choices and form the right habits that impact on our health now and long into the future. Poor health doesn't just cost lives, it costs money too. By preventing, detecting and treating disease as effectively as we can, public health can help to halt the spiralling costs of treatment, saving lives and saving money. Public health is about understanding the huge impact that our financial, social and environmental circumstances have on our health, and reducing the differences between us to make us all healthier. It's about making health achievable, in mind and body, at home and at work, by supporting individuals, families and communities in the environments they live and work in. It's about working to ensure that no one is left out or left behind as we strive for better. Public health. preventing disease, prolonging life, promoting health. For everyone, at every stage of life.
So we're now going to head over to CUH, where we're going to have a chat to Ken Perrott about the BSc in Public Health Sciences, what public health is, and we're going to meet Colm O'Reilly, one of our recent graduates of the BSc.
Right now we're in one of the lecture halls in CUH and I'm joined with Janice Harrington. Janice is Director of BSc Public Health Sciences and Senior Lecturer in Public Health Nutrition in the School of Public Health in UCC. So Janice, tell me, for a student looking at the BSc's Public Health Sciences, what would a student need to study?
The entry requirements, you require one lab-based science subject, and then you have a range of other subjects. So you have to have maths, you have your Irish, and you have to have your language as the entry requirement to any university course, but you do need one lab-based subject to come into the course. It is a science course, it's a BSc in Public Health Sciences, so there is that science requirement to get a place on the course.
And for graduates, what jobs are available?
Depending on the area of interest and the graduate's area of interest, the graduate can take a number of different career paths. We have students working as surveillance scientists in the Health Protection Surveillance Centre. We have students working in the public health departments in the HSC. We have also students working in oncology clinical trials. But at the other end of this, some of the other areas, we have a student or a graduate who is the Healthy Club Coordinator, the National Healthy Club Coordinator with the GA, the Community and Health Department in the GA. We have other students who are working in community development projects, and we have other students working in as the health media communications with Public Health England. We've other graduates go on and do postgraduate courses and using the BSc as an entry point into some of the clinical therapies, whether it's occupational therapy, speech therapy, radiology. Other students go on to graduate entry programs to medicine. So there is something for everybody within the BSc in Public Health Sciences. And over the course of the 4 years, the students really get to hone their interest and given the freedom with the electives and the choices of subjects to really kind of delve into the area they're interested in.
And what would be a highlight from the course?
A highlight for the course, I think, would be one of them, or one of the many highlights. We really put an emphasis on group work and working within small groups and small teams over the course of the 4-year programme, because I think within public health, as a public health professional, it's really important to be able to work in teams with different people. So that to me over the course of the 4 years is a highlight. But I suppose speaking to graduates and current students, the one thing that students always look forward to is their 3rd year 12-week work placement. And that happens between April and July in the 3rd year of the programme. And again, the work placements reflect, I suppose, the career options or the career paths for our students. And we tailor and match the work placement to the interests of the students. Another highlight is the option of studying abroad in your 3rd year. So students have the option of spending the whole year abroad at studying a public health related course in a different university. Maastricht or London are 2 examples, or they can choose to opt to spend a portion of the year, either semester 1 or semester 2 in 3rd year. So they're really 2 exciting parts of the programme that really open up a whole lot of opportunities for students, because within the work placement, many of our students end up being employed in those areas, and some even have gone on to work in those areas after graduation within those organisations.
Janice, we hear a lot about public health these days, especially with all the COVID-19 talk that's going on, but it's a much broader subject. So just tell, if we park the COVID-19 situation for now, because hopefully the people that are watching us right now, by the time they're doing the Leaving Cert, COVID-19, if nothing else, if it's not a distant memory, it will be a different playing field. So what else is involved?
So public health, as you say, is much broader than COVID-19, and the aim of public health is to protect and promote the health of all our population. Now, that population could be within our communities, within nationally in Ireland, or even globally. And it's about protecting the health of our populations where we're living, where we learn, where we work, and where we play. Within public health, there is something for everybody. So if you're interested in number crunching, or really, have an aptitude for maths, for example, or computing, or if you have an interest in lab sciences or lab research or field research, or another end of the scale, if you're interested in working with policymakers and dealing with policymakers, or working with communities and individuals to help improve their health. That's where public health is. So public health works across the broad, all of that scale or that spectrum. Within, I suppose, public health is entwined in our everyday lives. From, in every conversation that we hear in the news, that we read in the newspaper, there's an element of public health to it. So from climate change and the environment, to sexual health, from infectious disease to promoting healthy nutrition, and healthy lifestyle behaviours, from mental health to physical and emotional health, and also from, say, violence to the homelessness, housing, transport, tourism, and our I suppose the health and safety of our community. So every aspect of our lives entails some aspect of public health.
What do public health professionals do?
So public health professionals what we do is we try to understand population health. We try to understand what are the drivers or the determinants of population health, and what makes people healthy, what makes people not so healthy. And we look at our lifestyle behaviours, and we try and measure and assess our lifestyle behaviours within a community, not at the individual level, but community behaviours. We also, so that's kind of our exposures, or our what we call our determinants of our health, from be it our behaviours or our social networks, our wider environment. So what's in our environments that actually impacts on our health. The other end of the scale, we look at monitoring a disease or illness within the community. So whether that's COVID-19, whether it's levels of obesity, whether it's cardiovascular disease or diabetes or cancer. So we look at the levels of disease within the community. So we're doing research to monitor and look at surveillance of these types of diseases. And then we're looking at, to try and, I suppose, understand the associations between our exposures or our risk factors or determinants and our disease outcomes or our health outcomes. And by understanding those, if we know what is driving levels of health or ill health within our community, we can act and intervene and at different levels to implement interventions to help improve the health of that community, to encourage behaviour change, and I suppose to create the environments within our communities that make the healthier choices, the easier choices to make for everybody. So we're here now in the Western Gateway building, and we have some of our current students. So we have Shauna here, is our first year students. We have Emma and James, our second year students, and Lauren is one of our fourth year students. So I suppose I wonder, why did you decide to choose public health? So when you were looking at your CAO, and there's all of these courses that you could do, what led you to public health?
I guess I didn't want to do a solely lab science course, and I really liked geography and biology, and it felt like a good mix of the two subjects.
And maybe Emma and James, why did you decide to do
Yeah,
that?
well, I was interested in health. Like, I was really interested in biology in school, and I liked how broad the course was in general. I liked how there was specific science subjects like physiology and microbiology, but also kind of broader aspects to it, like sociology or maybe management in public health systems. So I was also interested in the kind of routes that you can take into the master's degree through public health sciences. So initially I wanted to, well, the top of my CAO was occupational therapy, but I was interested in public health sciences as well, because you can get into occupational therapy after public health sciences. So I was interested in that aspect to the course as well.
And was it your first choice?
No, actually, I didn't know what I wanted to do after my leaving, so I decided to take a year out because I was so unsure of what I wanted to do, I suppose. And when it came to the second time I had to fill out my CO, I did decide to put it first, because I think after the year it's so difficult to decide, especially just after you're leaving cert, what you want to do. And I was so indecisive, so I just said I'd take the year out, and then I obviously am happy now because I'm in second year. So yeah, it was my first choice the second time round.
Yeah. And Lauren, you're in fourth year now, so you've had 4 years. So what for you has been your favourite part of the course?
I think my favourite part of the course has been the fact that it's so broad, and like the guys were saying, we all had interest, I think, in biology and geography, and now that I'm at the end, I can look back on so many different disciplines that I now have a foundational understanding in them. And I think at this stage, when you kind of are looking to go out into the workforce, you see how all of those different disciplines tie together and shape a knowledge that you can put into practice and research, or maybe more clinical, or a master's if that's what you choose to do. But it kind of really is all encompassing, and I think graduates of this course have a foundation in a lot of different things. And in some courses you're kind of mainstreamed and you might come out with kind of a conventional job, and I would say, don't let that deter you from public health, that you're not coming out with a conventional job, because you have so many different skills that companies and workforce think are really, really valuable, especially now today. I think it just shows public health is only getting more important. So I think, my favourite part of the course has been that whole all-encompassing broad spectrum of modules.
Here, when the pandemic kind of started, my dad was like, "Oh, I finally understand what you're doing in college now." People were stop asking me, was I going to be a public health nurse? Yeah. literally, I'd say that's the biggest question. Are you going to be a public health nurse? And there's nothing wrong with that, but you would go into general nursing for that. But I think this is a lot more behind the scenes. Like as you were saying, there's a lot more variety to the course. It's not just it's not nursing, I suppose. It's more what goes on behind the scenes. So the HSE, a lot of non-governmental organisations like charities and stuff, you could end up working in those. So yeah, I think that's what led people to the course. In our year anyway, definitely a lot of people wanted to specialise, but then decided to do this just as a kind of foundation, so that you can kind of lead on to other things in the future.
And when people ask you now, what is public health? What do you say? Or is it easier now?
I think it's important for people to understand that public health isn't all about disease and ill health and things that are negative, because often I think when you look at the professionals who work in the news and in NEFIT and at the government level in public health, it can sometimes be very critical and very negative. But I think you have to understand that each of those individuals has an understanding of lots of different things. They understand microbiology, they understand health systems, they understand management, health economics, and this course dips into all of those different things. So I think when people ask what is public health, I am terrible at explaining it because it's so hard to explain. It's better to maybe give an example of how we go from, I don't know, nutritional research and, epidemiology and looking at, different nutrients and how people eat. And then we bring that into a research paper and that's published. And then that paper is used for health promotion or helping healthy eating in schools or workplaces. So it's really a process going through lots of different things. So it's not all bad, it's not all disease and death and, hospitalizations. So I think that's really important as well to keep in mind.
Yeah, I think that because epidemiology is like a main module in the course, that if someone was to ask me what public health is, I would kind of say that it's kind of studying the association between exposure and outcome really, and different kind of phenomenons that have been studied. And so I would say that epidemiology is one of the main modules in the course.
There is a good bit of history in the course as well.
Yeah.
Like health history. So like I remember, especially first year epidemiology, you go through a lot of the, as you would know all too well, you go through a lot of historical epidemiology. So if you're into history, I suppose it would be a really good one as well.
I think sometimes there's a lot of misconceptions with what we study. For example, I remember telling friends that I was studying epidemiology and they thought I was going to be a skin doctor. So like that's dermatology, but epidemiology is totally different. It's studies of populations and diseases and outcomes and how the two are associated. How to keep populations healthy by studying what causes disease and how and when and in who, at what time. So it's very different to being a skin doctor.
I mean, still though, epidermis, that's leaving cert biology at work there now.
So why UCC and what is it like to be a student of public health in UCC?
I think when you grow up in Cork, like you always, either like cousins or people that you may know who are older than you, they would be going to UCC, and I suppose other colleges in Cork wouldn't offer the public health degree or even kind of health sciences degree. So yeah, I more chose UCC out of convenience, but it was also a course I really wanted to do, and this is kind of the only like university in Ireland who offers an undergrad in public health as well.
Yeah, and there's so much facilities in UCC as well that are like such high quality, like the Mardyke, and there's so much like the restaurant, cafes and New Bar, there's the library, there's literally everything that a student could ask for coming into college life. There's so much opportunity to join societies and clubs. Every year, at the start of the year, each club and society make an appeal to the students to join their societies. So there's so much options to get engaged in the college life, really. So.
Yeah, I think for me, one of the reasons I picked public health in UCC, and it was my first choice because I think UCC has a reputation for having a really good research culture, and it's very creative, and there's a lot of very interested people who work here. And as a 6th year student or a 4th year student, like you kind of don't understand what that is, but I picked it because I thought that, at the end of this 4-year degree, I'm going to have met a lot of very interesting people, worked with a lot of different kind of types of academics, but also professionals in the real world, while all the time making so many friends, working so much. We do lots of team working and group projects, and sometimes they can be annoying. I'm sure you probably online, they're not very fun, but they when you go into a workplace, having teamwork skills are just so incredibly important, and this degree definitely helps you develop those skills.
It's really I suppose easy to make friends as well, because with me and James's year, there's only 30 of us. So you're going to statistically come out with at least one person that you're friendly with. We all have the same interest in health, and if you are working in group projects, it's really easy to keep in touch with them as well, whoever you're doing the project with.
Yeah, even interacting in the lectures and stuff, it's just easier because it's not so intimidating with such a small class. It's not hundreds in the course, so you're not afraid to interact with either people in your course or the lecturer themselves. So yeah.
Yeah, like we had a Zoom quiz over lockdown, our class organised it, and we've had various kind of class reps and people during the years, so we organised a Zoom quiz and we made a big quiz and included kind of lots of different things from public health, and we did that over lockdown because there's only about 20 in our course and everyone had so much fun, and it's to be able to say you get to the end of your 4 years with great friends that you know you might encounter again in your professional career is excellent.
Yeah, like although I haven't met any of my class like in person, I've had to do like projects with them, so I have met 80% of them, as like there is only 30 people in the course, which is like really nice because like your core modules will just be those 30 people.
And your lecturers will like know you as well. They might not know you by name because they're teaching like maybe a couple hundred students, but they definitely all make like a real effort to get to know you and your personality, and they're always there to like help you as well. I think that really helps with small class sizes, is they get back to you like really quickly, will help you settle in, will give you extensions if needs be, if anything happens.
It's kind of nice that like the Western Gateway has kind of like a floor for public health, and like I'm excited next year, fingers crossed, that I will get to go there. But like, do you know, it is nice to have like a designated place in college that is for public health.
So we're here now with 3 of our third year students. We have Kerry, Maeve and Kate, and they're just about to head off on their third year 12-week work placement. So can I ask you just to tell me, where are you going on your placements and why did you choose those placements?
So I'm going to the National Suicide Research Foundation, and they'd be one of the biggest, I suppose, charitable organisations for suicide and self-harm research in Ireland. The reason I chose it is probably on a personal level. I feel that it's a very important topic, and even though suicide is declining in Ireland and globally, it's still a major public health issue, so I'm really looking forward to getting into that.
Yeah. And Maeve, where are you going?
So I'll be doing my placement in the Infant Research Centre. So what Infant does is it tries to improve health outcomes for pregnant women, babies and children in early childhood. So I suppose like throughout our degree we kind of learned that like any intervention has to be, I suppose, based on evidence. So say now in the maternity hospital there, any intervention that happens would have to be based on evidence, like evidence-based practice. And I suppose I have like a great interest in kind of like being part of those studies that bring about this evidence.
Yeah. And Kate, where are you off to?
I'm heading off to the Oncology Clinical Trials Unit in CUH. I chose this placement because I have a huge interest in clinical trials. I also carried out the GCP course with the HRB, and I have a keen interest in data management. So I'm hoping to put what I learned in the classroom, hopefully, to like a real life data set.
And what are you really, what's the main thing you're looking forward to about your placement?
I think just getting out into the working world after being here for...
putting like what we learned in college into practice.
Yeah.
Absolutely.
Yeah. And like hopefully like forming relationships within the hospital, I think, and gaining experience.
Absolutely, yeah, and kind of networking as well, because we know that that's really important, like, and to make your network and get out there, especially if you want to go into research.
Yeah, hopefully then we get more opportunities down the line.
And just before we finish up, could I just ask you, if you had to give a student who's considering studying public health, if you had to give them any advice, what would you say to them?
I suppose go for it, like don't hold back, definitely.
You took the words out of my mouth, absolutely go for it. It was something I thought about for 5 years, and it's the best decision I've ever made.
So we're joined now by Emer. Emer is involved in the UCC Public Health Society. So Emer's going to tell us, what is this UCC Public Health Society?
Yeah, so we're a newly established society here in UCC. We're an interdisciplinary society made up of students from many different backgrounds, such as public health, medicine, dentistry, nutritional science. And basically we all kind of have a common goal to just spread awareness among the UCC community and beyond on all the various issues regarding public health.
What is the one benefit of being involved in a society as a UCC student?
So I think it's a really great way to meet new people and to make new friends, especially with COVID. You know, it's quite difficult for people to meet people. So I've made so many friends through the society so far, and it's great when you have common interests with people within the society as well.
And if students had new students advice, what would you give to first year students coming into first year in college?
So definitely joining a society would be one of them. It's a great way to meet new people and just to get involved with different things that you'd be interested in.
So I'm joined now by Dr. Maura Smiddy. Maura is a lecturer in the School of Public Health, and she's one of the lecturers on the BSc in Public Health Sciences. So Maura, I was wondering, would you tell me, before we talk about what you teach, what do you do in your everyday work? What research do you do?
Okay, so my background is in nursing and midwifery, and I spent a lot of my career working as an infection prevention and control manager. So a lot of the work and the teaching I do is related to infection prevention and what we call health protection. And when we talk about health protection, we're talking about imposing legislation to prevent damage to the health of the population through health damaging hazards. So this covers things like infectious disease, but also things like road safety, food safety, smoking, legislation regarding alcohol. So it covers a wide range of things. So it very much fits in with the overall concept of public health and protecting the health of the population. So they're the areas where I would teach, and then my research would be related to largely infection prevention research, but we also have fantastic opportunities to work with students in the school related to their dissertations and their research. So it's really, really, really varied.
So when you talk about infection prevention, what types of things would you do, or what would you who would you work with, and what type of interventions would you do to prevent infection?
Okay, so I suppose a really good example of this is the COVID-19 pandemic that that is happening currently. And in relation to that, we're talking about what people are very familiar with now, educating people about social distancing, educating people about mask wearing, educating people about the importance of hand hygiene. And that's just in the context of a pandemic. But beyond that, then, infection prevention in educating primary school children, the importance of hand hygiene at any time, educating people about antimicrobial usage and antibiotic usage, and when we should be taking antibiotics and when we shouldn't, to try and actually reduce the risks of things like antimicrobial resistance. We talk about infection prevention then in healthcare when we talk about protecting patients or people who have contact with healthcare from the risk of infection that they may acquire during the process of healthcare. So it's really, again, quite broad and very, I suppose, scenario specific. It depends which population you're looking at.
Could you tell me a little bit more about what you do in the BSc Public Health Sciences? So what modules do you deliver, what years do you teach, and what's in those modules?
I have a little bit of contact during the first few years of the BSc in Public Health Sciences, which is an introduction to, I suppose, the concepts surrounding health protection and infection prevention. But in fourth year, I have a module in semester 2, or the second half of the academic year, that focuses completely on health protection. And I love teaching this module because at this stage, people have a really good, and students have a really good understanding of public health overall. And when we go to health protection, they really get the concepts of how, legislating for actions related to health, public health, and how they work to protect the health of the population, be that within healthcare, be that related to health promotion as well, and education about how we protect our own health, but also related to legislation and looking at things like food safety and prevention of outbreaks, looking at emergency disaster management and what we do in the event of an emergency disaster, what are the steps that we need to do to protect people and to actually reduce the risk of those things moving forward as well.
And what type of work do the students do in that module? So is it all just lectures, or is it group work, or do they do presentations?
Sure. I mean, within that module, the assessment is a written assessment, but however, we do a huge amount of group work within the module as well. And I suppose what I really like about the module is you can take case scenarios. You can take, this is your situation, and you can put people into groups and say, now I want you to come up with a solution. And people get the opportunity to work with real life case scenarios to mimic what you would be doing in that context, in public health, in the real world, if you were working related to that area. So it's really a fun module in that sense. I suppose I find it fun because I'm teaching it. I don't know if my students find it fun, but it's very discursive, it's very chatty, it's very engaged. And a lot of the time, usually at the start of the module as well, I go to students and I'll ask them to fill out a form to say, are there areas that you particularly want me to cover that might not be within the timetable? And we try and touch on those areas then to try and get, I suppose, at that stage you're in fourth year, you know what you want from your BSc in public health. And sometimes if there was a gap, then I love to be able to address that for them at that stage, because, you know, they're going to be qualifying in a number of months after that. So it's great to have that opportunity to engage with students and let them make their module their own to some extent as well.
So I'm joined now by Colette Cunningham. Colette is a lecturer in the School of Public Health, and Colette lectures on global health on the BSc in Public Health Sciences. You teach global health to the BSc in Public Health Sciences students. So can you tell me what is in that module that you teach and what do the students study?
Okay, so I suppose global health is a very broad term, and it includes, you know, everything from social sciences to, you know, infectious diseases. So we cover communicable diseases, non-communicable diseases. We cover outbreaks. We cover earthquakes, natural disasters. I mean, it's extremely broad, but it has a focus on a global aspect, and predominantly with the developing world. Concerns the developing world, and also the tension between the developing world and the developed world. So, for instance, we cover migration issues, we cover war and health, and all of that is based within the Sustainable Development Goals. Okay, so we link it very. We're using that very much as our framework at the moment. So it's a very interesting module from that point of view. I have speakers who come in from the School of Law. Human rights, people who've had experience from a war perspective, from conflict, natural disasters. I worked myself in Haiti after the earthquake. So people like it because it's a little bit different, and it's very current at the moment with COVID and with the COVID pandemic. In fact, one of the classes is pandemics, epidemics and outbreaks, even before this, you know. So, and over the years, the numbers have just increased and increased, you know, and it's also varied because it's an elective, and it's an elective not just for BSc students, you know, public health students, but also from other cohort of students across the university, from government studies, international development, and that makes for a very interesting dialogue within the classroom.
Yeah, so they get to meet and interact with students from other courses as well.
Yeah, and we've had also visitors visiting students, and they come from a variety of backgrounds, and it definitely, it's a very interesting class, and I love teaching it.
What type of work do the students do in the module? So is there group work or their presentations?
Yeah, so it's kind of, I suppose it changes over the years, and I adapt it, but one task that we've been doing is they have to write a report for the UN as if they were UN workers. So they work in groups. And within the UN system, you have to work a lot in teams, and so it, you know, sort of prepares them from that. And quite a number of students have gone on to do masters in global health, and a number of students have gone on to work in humanitarian organisations, and also have gone into the UN system as interns. So it's a good stepping stone.
Brilliant. Thank you, Colette.
Okay, thank you very much.
So now I'm going to talk with Ed Murphy. Ed is one of our graduates from the BSc in Public Health Sciences, and Ed graduated in 2012. So Ed, you graduated 2012. I was wondering, would you just tell me what have you been up to since you graduated?
Yeah, so I'm working with the HSE at the moment. I'm a project manager on the Tobacco Free Ireland programme. As the name would suggest, the Tobacco Free Ireland programme is part of the HSE that manages all things tobacco control. We would have very, very defined goals and targets. The first of those being to prevent people from starting to smoke in the first place, and the second being to help people who do smoke to quit and to stay quit. And we would manage a very wide-ranging suite of projects that contribute to doing all of that. We take a lot of our direction from the Department of Health. They have a Tobacco Free Ireland strategy, and that gives us our roadmap for the work that we undertake in the HSE.
And what would your day-to-day, every day look like?
So it varies. We have a very diverse body of work, so no day is ever the same. I think probably the most public-facing thing that the HSE does in tobacco control would be the Quit campaign. So people will be familiar with the TV and radio adverts, but there's a whole range of services behind the campaign that we're directing people to use to try to quit smoking. So there's the 1-800-201-203 phone number, where people talk to Stop Smoking advisors, but we have about 70 face-to-face clinics around the country as well, where people can go and meet with a Stop Smoking professional to get information about behavioural support and the medications that they can use to quit smoking as well. And we basically work to ensure that these services work for the people that use them. We would do a lot of internal advocacy work in the HSE as well. So we'd work with doctors, nurses and allied health professionals to make sure that tobacco use is on their radar, so that when they meet patients who might smoke, that they can make meaningful interventions with them and set them on the road to quitting as well. And we'd also do a lot of work outside of the HSE with city councils and county councils to do what we call denormalisation of tobacco use, and that's about protecting children from tobacco smoke. So we do things like smoke-free parks, beaches, playgrounds, and all that kind of stuff.
So do you work as part of a broader team, or is there just yourself, or who do you work with?
Yeah, so there's a whole team of us on the Tobacco Free Ireland programme. There'd be maybe 7 or 8 of us, and we'd also work with some of the public health doctors who would provide clinical advice to us for the programme. But tobacco is not the only programme in health and wellbeing in the HSE, so you'll have very similar programmes for healthy eating and active living. You'll have a mental health programme, sexual health programme, a staff health and wellbeing programme, positive ageing, healthy childhood, and they all work in a similar way to us in that they'll all have their own very defined bodies of work, but obviously there's crossovers between us and we'll work on joint initiatives together as well a lot of the time.
Okay. And are there opportunities on your team or within the area you work for graduates of the BSc in Public Health Sciences?
Oh yeah, definitely. I mean, the HSE has a specific grad link programme that takes people who have just graduated from college to work in different programmes in the HSE.
As a graduate of the BSc in Public Health Sciences, if you had one piece of advice to give somebody who is considering studying or applying for the BSc in Public Health Sciences, what would you say to them?
I suppose COVID has cast public health into the limelight in the last 12 months, and there's definitely an awareness among people, more so than there was 12 months ago, about what public health does and what it is. So I think if you're somebody who maybe watches NEFIT briefings at home or COVID-19 segments on the news with your ears pricked or a raised eyebrow, or in a more general sense, if you're scrolling your Twitter feed and you find yourself reading posts about healthcare and you like reading about data associated with healthcare, I think you would probably love this BSc. Yeah.
So Ed, before we finish up, if you were to give your transition yourself a piece of advice, what would you give yourself? What would you say to yourself?
Well, I think certainly when I was 16 and in transition year, I really didn't have any real concrete ideas about what I wanted to do or what I wanted to work in. But I would say to people, don't worry. If the public health degree is interesting to you, it's a really, really, really diverse type of degree, and it'll take you from epidemiology to microbiology to politics and public policy and everywhere in between. So there's a huge range of jobs that you could end up doing after the public health degree. It doesn't necessarily pigeonhole you into healthcare or public health. You'll be very qualified to work in a really, really broad range of industries, I think, after doing it.
So I'm here with Martin Davern. Martin is a graduate of the BSc. He graduated in 2010. Martin is now the director of the Sexual Health Centre in Cork City. So thanks, Martin, for coming along today. I was wondering, could you tell us what you've been up to since the BSc, since you graduated?
Yeah, so I graduated in 2010 with the BSc in Public Health Sciences, and I went on to complete the Masters in Public Health in the School of Public Health here in UCC, and then did my PhD, which focused on alcohol consumption. From there, I did a plethora of postdocs, and I was Assistant Director for Networks with Sphere. And I suppose my research really focused on alcohol, drug use and sexual health, and how we make decisions around those, and sometimes they can be risky decisions, and how they can impact on individuals, on societies and populations. So 3 years ago, the opportunity opened at the Sexual Health Centre to become its executive director. So I went for the job, and I've been there since. But luckily, I'm still an adjunct with the School of Public Health, so I've left, but not quite.
And so in the Sexual Health Centre in Cork, what type of work do you do?
So yeah, the Sexual Health Centre in Cork is a non-governmental organisation. We work really to provide people with education, information and support, as well as testing opportunities in relation to their overall sexual health and well-being. Now, often when it comes to something like the area of sexual health, people go straight for STIs, and we think about infection control and what it is we need to do. But sexual health is a really broad area. You know, it can cover reproductive health care, it can cover healthy relationships, it can cover an individual's sexuality and how they interact with that, but also how they have the capacity to make good, informed choices that improve their sexual health outcomes, and then in turn improve their overall health and well-being. I think the great thing about the BSc in Public Health is that it gives you a range of opportunities. And we can often think of public health as just HSC public health departments, but there's so much more to that. And the BSc in Public Health definitely gives you the skill sets to join an NGO, a responsive NGO that's trying to implement on the ground interventions for people. It gives you the skill set you require if you want to work in data analytics, if you want to work in health service management, if you want to work as a one-to-one practitioner, a support worker. You know, the great thing and the thing I loved when I was doing the BSc in Public Health is that it has a real range of modules and opportunities, from sociology to epidemiology to statistics, and all of those skills really come together when you're trying to change the health outcomes for an overall population.
So Martin, if somebody was considering studying the BSc in Public Health Sciences, what advice would you give them?
I suppose for me, I tell them to do it. I really enjoyed my time in the BSc in Public Health Sciences. I feel like it was an opportunity to get into healthcare without having to be a frontline healthcare worker. And if that's something that you're interested in, if you're interested in changing the health of a whole population, if you're looking for an area of healthcare where you can get involved at societal level, where you can change a structure or you can change a system, the BSc in Public Health Sciences gives you that opportunity and to develop the skill set to do that effectively.
And Martin, in the Sexual Health Centre, you take workplace students from the third year students from the BSc in Public Health Sciences. So on their workplace, what type of work would they do?
Yeah, we love taking the placement students from the BSc in Public Health, and it was something that was happening long before I arrived at the Sexual Health Centre. The whole team really feel like it's a benefit from the organisation. You know, the student comes in, my team learns from the student as well as the student learning from the organisation. Placements, we try and actually derive our placements based in consultation with the student. So they join our team and they kind of get an overall flavour for the organisation. They can work on reception, they can work with the health promotion team, they can do outreach workshops. So we do health promotion with young people in non-formal education settings. We do health promotion interventions with individuals who we think are marginalised from Irish society. So that might be members of the migrant community, it can be individuals who are in homeless services, it can be individuals who are involved in drug and alcohol services, and how we can better support them and provide them with the information and education they need to improve their sexual health outcomes. So students have really benefited from being going out with our health promotion team and seeing how actually all of the theory that they've learned throughout the BSc in Public Health Sciences gets translated and implemented on the ground for the community. And I remember when I did my placement, that was one of the things I loved. You actually get to see how theory can translate into policy and practice and on the ground interventions. One of the things I loved in the BSc in Public Health, when I did it in Public Health Sciences, was there was a real range of placement opportunities. So throughout the first 3 years, you would have learned about health promotion, health prevention, you would have learned around health intelligence and what public health was. And the placements matched all that. You know, there was things in the Sexual Health Centre in Niche, there was analyst programmes with the NHS in the UK. I know they've expanded to Denmark and the WHO. You know, there is a real range of opportunities.
And finally, Martin, if you think back to when you were in transition year, what advice would you give yourself?
I actually think I'd tell myself to follow my gut. So I knew I always wanted to work in the area of healthcare in some way, shape or form, but I'm not a person that was built to interact with, to be a frontline healthcare worker. You know, I would have found that very stressful. I would have second guessed myself all the time. It just wasn't something I really wanted to be involved in. But I did want to work in the area of health. I wanted to somehow make a difference for society. And it was actually in TY that I did find out about the BSc in Public Health. So we got one of those massive booklets of these are all the courses that you can do. And the BSc in Public Health was an opportunity to get involved in healthcare, but in a space where I was comfortable to do it. So you could improve health outcomes for an awful lot of individuals rather than for one. And so for some people, being a frontline healthcare worker is an absolute right fit, and that's where they should go to. But for me, I found the right place for me by doing the BSc in Public Health.
So we focused on some of the career opportunities that are available through this course. We focused on some of what the course entails. Now let's focus on one of the recent graduates. Colm O'Reilly is here, graduated from BSc Public Health Science in 2020. Colm, how's it been since you graduated?
It's been a busy time for public health graduates, obviously a very important and exciting time to be working in public health. Straight after graduating, I went and I started working in the contact tracing program with the HSC, and I recently became a shift lead on the HSC contact tracing program. So obviously, yeah, it's been a very busy few months.
Now let's go back to when you joined the course. First of all, this is pre-COVID. This is back in a time when we didn't know what COVID-19 was. What made you look at that course and go, that's the one for me? Because there's a lot of options out there.
Yeah, so I think like most people at 17, 18, it's so difficult to kind of figure out what you want to do. I knew I wanted to go into health sciences in some guys, but I wasn't sure, and I wasn't sure enough to kind of commit to one specific area. So I saw the BSc in Public Health Science as a perfect entry point into healthcare, health sciences, research, anything like that. And yeah, it seemed like the perfect entry point for healthcare for the rest of my career.
Back when you were doing your CAO application and someone said, what do you want to be? Did you know?
Absolutely no idea.
How about now? Do you know now?
Yes, definitely. So after graduating last year, I decided to apply for an MSc, a Master's in Epidemiology. So really, that's one of the core tenets of the BSc in Public Health throughout my 4 years of college. So epidemiology is the analysis and of the distribution of different types of diseases. So my particular interest is in infectious disease, but it's the analysis of distribution of all different types of disease, including lifestyle diseases like obesity and infectious diseases like COVID-19. So ideally, in the future, I'd like to work as a field epidemiologist.
I get the feeling about this course, after talking to Janice earlier and talking to yourself now, that for people out there who know they want to do something within science and they're just not sure which facet they want to go, because it is quite broad, is this the right course to look at?
Absolutely. I think the best part of this course is the amount of disciplines you get exposed to throughout your 4 years. You know, throughout my 4 years, I worked with in stats, in nutrition, microbiology. These are all modules that I worked on, and they give you a real rounded view on what it means, what population health means. And you can always shoot off into those little tangents after your 4 years. It's such a good entry point, and the fact that you're exposed to so many different disciplines throughout your 4 years is a real positive.
Colm, I want to quickly look at the idea of contact tracing. You said you're working in that at the moment. First of all, how has your degree helped you in that form? And secondly, contact tracing isn't exclusive to COVID-19. It's something that we can develop and really progress with other diseases.
Yeah, so I think the COVID-19 pandemic has shown the need for increased investment in public health departments, and my BSc in Public Health has really prepared me for the work that I'm doing at the moment. During your time in public health, you work a lot with different sources of data and data input and analysis, and that's something I work with every day. Is we get so much information thrown at us every day in terms of emerging variants of COVID-19, outbreaks and clusters of the disease. And my 4 years in college has really prepared me to analyse that data that I get every day and then make decisions based upon it.
And then with this degree, again, the likes of contact tracing is going to be something you could travel all over the world with, but not just contact tracing. What you've learned in UCC, you can take with you across the world. These are transferable skills that you can take anywhere in the world. And there's a real need for public health work in the developing world, it's like South America and Africa. And infectious disease epidemiology is a huge area in that regard. So if you're looking to travel, public health would be a great degree to start with, because there's such a need for dedicated and passionate people within this area. And what skills do you think that a public health professional should have outside of the points and the academic side of it? What do you need as a person? I think in his appreciation for equality, equity and inclusivity. Really what we want to do is make sure that everyone in the population gets the same opportunities in terms of their healthcare. And appreciation for that, and as well as being able to analyse and make decisions based off a whole stream of data that you're given every day is a huge skill that you'll need during public health work. Is it a stressful job? At the moment, working as contact tracing during the COVID-19 pandemic, particularly over January when we had the massive surge, that was quite stressful. But again, I'm incredibly proud of the work I'm doing, and I really believe that we're making a difference. And I'm quite passionate about helping and improving population health. So while it can be stressful, you really get a sense of satisfaction and appreciation for the work that you're doing.
Hello, I'm Elizabeth Keane. I'm a public health physician. I'm UCC graduate, but for 20 years I've been working as a public health doctor here in the Department of Public Health covering Cork and Kerry, covering a population of about 600,000 people. Now, our day-to-day work is really exciting, it's interesting, it's fascinating, it's very, very versatile, and it changes from day to day. What kind of things do we do? Well, we manage outbreaks. We're like disease detectives in that we might get notified of an outbreak of food poisoning, or of measles, or of meningococcal disease, and for the last several months it's been about pandemic coronavirus. So it's an exciting time. We try to investigate the source of all of these outbreaks, we try to manage them, we undertake surveillance, and we try to control them. So it's all about prevention and making people's lives better. We investigate environmental incidents, might be an explosion causing a plume, or it might be a flooding, or it might be an episode on an aircraft where people have got sick. So again, investigation and surveillance. We also manage, I suppose, how to improve people's health. We advocate for people who have particular needs, be they older people or children with disability. I bring all of that to my work in UCC. I coordinate a module in the BSc Public Health Issues, where we deal with the biggest public health issues of the time. We explore them, we find out what causes them, and we see what can be done to prevent them. And these are the issues such as, again, as I've said, the pandemic, we've been doing it this year, but also alcohol, tobacco control, screening, cancer epidemiology. And what I can do then is share with you, as our students, all of these events. Which brings us to the future. The COVID has had a silver lining. And I suppose there is going to be a great future for public health practitioners such as you, whether you want to be disease detective or whether you want to be investigating outbreaks or environmental incidents, whether you want to be surveillance scientist or information scientist, or whether you want to just improve the health of the people that we serve. Thank you.
Thank you for joining us here today to hear more about the BSc in Public Health Sciences and the School of Public Health. If you want to hear any more information about the courses we teach, the research we do, or the other work that we do within the School of Public Health, please contact us or visit our website for more information.